Hello everyone, I am Dr. Shadab Ahmad Mohammed, consultant cardiologist at Care Hospitals Malakpet. So today we'll be discussing an important topic, that is pregnancy and heart disease. So pregnant females can develop heart disease, or people who have a heart disease from their childhood or who can develop the heart disease in adulthood can get pregnant. So how to manage a heart disease in pregnancy and what all heart problems can be seen in pregnancy we'll be discussing. So pregnancy is a hyperdynamic state. So whenever a person gets pregnant, the blood volume in her body starts increasing, and at the term gestation, the blood volume has increased so much that the heart has to pump the increased volume to the entire body and also to meet the demands of the fetus. So commonly what we see in pregnancy is that whenever the heart has to pump blood at the higher loads, it can fail. This is called as peripartum cardiomyopathy. So the muscle becomes weak, the heart muscle it becomes weak, and this leads to reduced pumping of the heart. So this can occur in the last trimester, that is 1 month before pregnancy, or it can develop even after delivery also till 6 weeks. So the common symptoms with these are difficulty in breathing or palpitations, or they can also develop pedal edema. So this is one thing which we can see commonly in pregnancy. The other thing is that people who already have heart disease, that is, who have a valvular heart disease or who have a congenital heart disease, like who have a holes in the heart, they can go on to develop pregnancy. So in such patients also we need to be very careful about continuing the pregnancy, and the monitoring should be very careful. So some patients who have undergone a valve procedure in their childhood or who have a valve replacement done in their childhood, they also need to be monitored carefully during their pregnancy, because pregnancy is a hyperdynamic state and it can lead to high blood pressures, high heart rates, and also volume overload. So all these can put a stress on the heart, and such people, they become symptomatic even if they were not symptomatic before pregnancy. So it's important to screen pregnant patients for heart disease in the second trimester, and if the heart disease is found, then it is important to manage accordingly. So there are some heart diseases which have a very high risk to the fetus and the mother, so the pregnancy needs to be terminated. However, there are various other heart diseases which can be continued safely during pregnancy, and we need to be carefully monitoring such patients for worsening of their heart disease, and they need to be treated at an expert center. Thank you.